Hello, good morning dear children. I hope all of you are fine and safe as you all are at home in this pandemic situation. The Junior Red Cross and Scout and Guide team of Sacred Heart International School Marthandam feel proud to highlight some first aid tips for you. When I use the term first aid, we need to understand the meaning of this term better. What is first aid? Children, first aid is an emergency care given immediately to an injured person to protect his or her life. Before it is becoming very worse, if we give small help, assistance, we can save the life of an injured person. Remember that first aid is not a treatment, it is the help we do with the available materials at the time of injury or accident. Dear children, lives can be saved even without the first aid kit. When I say all these things, I remember a verse from Tirukural, the Tamil poem. காலத்தினார் செய்த நன்றி சிறுதனினும் ஞானத்தின் மான பெரிது. It means our help may be very small, but it may give better result. It will be better than or bigger than this world. When we do small help to an injured person or a person who met with an accident, we can save his or her life before he or she gets actual treatment by the doctors. Dear children, here comes our Junior Red Cross Scout and Guide team with some first aid tips. See it, learn it, implement it to help the people whenever need. Thank you.
அன்பு மாணவ செல்வங்களுக்கும் பெற்றோர்களுக்கும் என் இனிய வணக்கங்கள். அன்பினையே வாழ்வின் அடித்தளமாக்கி ஒழுக்கத்தை உயிராக போற்றி மானத்தையும் வீரத்தையும் கண்களாக கொண்டு இரக்கத்தில் சிறந்து கொடையில் உயர்ந்து வாய்மையும் தூய்மையும் நீதியும் நேர்மையும் அணிகலன்களாக கொண்டு நாம் வாழும் வாழ்க்கையை வளமுள்ளதாக மாற்றிக்கொள்ளும் முயற்சியில் நாம் தினம் தினம் முன்னேற்றத்தை நோக்கி பயணித்து கொண்டிருக்கின்றோம். அவ்வாறு பயணிக்கும்போது எதிர்பாராத விபத்துக்கள் ஏற்படுவது உண்டு. அவ்வாறு ஏற்படும் விபத்துக்களிலிருந்து நம்மை பாதுகாத்து கொள்ளும் முயற்சியில் நாம் ஒவ்வொருவரும் முதலுதவி பற்றி தெரிந்திருக்க வேண்டியது மிக மிக அவசியமான ஒன்றாகும். முதலுதவியின் நோக்கம் உயிரை காப்பாற்றுதல், நோயின் தன்மை அதிகரிக்காமல் தடுப்பது, விரைவாக நலம் பெற முன் ஏற்பாடு செய்தல். முதலுதவி என்பது எதிர்பாராத சூழலில் காயப்பட்ட அல்லது நோய்வாய்ப்பட்ட ஒருவருக்கு உரிய மருத்துவ உதவி கிடைக்கும் வரையிலும் சுற்றுச்சூழலில் அடிப்படையாக கிடைத்த வசதிகளை பயன்படுத்தி அதற்கென பரிந்துரைக்கப்பட்ட முறையில் உயிரை காப்பாற்றுவதற்கு அல்லது தக்க வைத்து கொள்வதற்கு வழங்கப்படும் ஒரு அவசரகால உதவியே ஆகும். முதலுதவி வழங்குபவர் ஒரு மருத்துவராகவோ அல்லது மருத்துவர் அல்லாதவராகவோ இருக்கலாம். ஆனால் உடனடியாக பாதிக்கப்பட்டவரின் நோயின் தன்மையினை அறிந்து அதற்கு ஏற்றாற்போல் பதட்டம் ஏற்படாமல் தகுந்த உதவிகளை அளிப்பவராக இருக்க வேண்டும். தற்போது விபத்துகள் என்பது விளையாட்டு, வாகன விபத்து, தடுமாறி விழுதல், மாசு நிறைந்த சுற்றுச்சூழலியல், இருதய நோய், தவறான மின் இணைப்புகள், நீர்நிலைகள் ஏற்படும் விபத்துகள், கட்டுப்பாடற்ற நெருப்பினால் ஏற்படும் விபத்துகள், இயற்கை சீற்றங்கள் என எதிர்பாராத விதமாக ஒருவரோ அல்லது பலரோ ஆபத்தான நிலைகளுக்கு தள்ளப்படுகின்றனர். அப்படிப்பட்ட சூழலில் நண்பர், உறவினர் என பாராமல் தகுந்த முதலுதவி அளித்து அவர்களின் உயிரை காப்பாற்ற வேண்டியது நம் ஒவ்வொருடைய கடமையாகும். எனவே நாம் அனைவரும் ஆபத்தான நிலையில் இருக்கும் ஒவ்வொருவருக்கும் சிறந்த முறையில் உதவி புரிந்திட சரியான முறையில் முதலுதவி அளித்திட கற்றுக்கொள்ள வேண்டும் என்ற சீரிய நோக்குடன் சில பொதுவான விதிமுறைகளை பின்பற்றி அனைவரும் அறிந்து கொள்ளும் நோக்குடன் எங்கள் சேகர்ஹாட் இன்டர்நேஷனல் பள்ளி மாணவ மாணவியர்களின் புது முயற்சியினை வரவேற்கின்றோம். அனைவரும் முதலுதவி அளிக்கும் செயல்முறை விளக்கங்களை கண்டு பயன்பெறுவீர்களாக. நன்றி.
Tips to follow. Do's and don'ts of COVID-19. Tip 1. Practice good hand hygiene. Wash for at least 20 seconds. Use any soap or liquid soap to clean your hands. If you can't use soap and water, hand sanitizer is a good alternative. Apply hand sanitizer and clean your hands. Make sure the sanitizer you're using is 70% or more in alcohol. Always carry hand sanitizer with you. Tip 2. Wear a mask. Make sure it covers both your nose and your mouth. Tip 3. Practice social distancing. Maintain at least 6 feet of distance between you and others. Don't ignore your own symptoms. Common symptoms of COVID are fever or chills, shortness of breathing, difficulty in breathing, fatigue and more, cough, and loss of taste or smell. Hey, stop. Avoid touching each other, okay? No handshake, no hugs, no high fives. Instead, you could say vanakkam and wave each other to greet others. Say hi, vanakkam. Alright, hi, vanakkam. Do exercise regularly. Eat a healthy diet. Get plenty of sleep. Wash your hands often after you cough or sneeze.
First aid measures to be followed during seizure. Clear the area around the person of anything hard or sharp. This can prevent injury. Put something soft and flat, like a folded jacket, under his or her head. Loosen ties or anything around the neck that may make it hard to breathe. Turn the person gently onto one side. This will help the person breathe. If it lasts for more than 5 minutes, call to your doctor.
First, if possible, turn power off to shut the source of power, or else try to separate the person from the source of current with a non-conductor tool like a broom, wooden stick, plastic stick, etc. Check whether the person is conscious. Gently tap the shoulders. Do not move the person unless the environment is dangerous. Listen for breathing sounds. Also check the pulse rate. If the person is breathing, place him in a recovery position. Use the arm to support the person's head and neck. Gently take the bent knee closest to you and very gently roll the person away from you. Tilt the head back and make sure the airways are clear. If pulse and breathing are absent, commence CPR while waiting for the ambulance. Alternate 30 chest compressions with 2 rescue breaths. Repeat if necessary.
First aid care for a broken bone. If you suspect that someone has a broken bone, provide first aid treatment and help them get professional care. Stop any bleeding. If they are bleeding, elevate and apply pressure to the wound using a sterile bandage, a clean cloth, or a clean piece of clothing. Immobilize the injured area. If you suspect they have broken a bone in their neck or back, help them stay as still as possible. If you suspect they have broken a bone in one of their limbs, immobilize the area using a splint or sling. Help them get into a comfortable position, encourage them to rest, and reassure them. Cover them with a blanket or clothing to keep them warm. Get professional help if the case is severe.
First aid for loss of consciousness. Loss of consciousness is the state in which the patient does not respond to external stimuli. Common causes of loss of consciousness are common faint, head injury, epilepsy, poisoning, shock, asphyxia, heat stroke, and electric shock. The first aid measures are: put the patient in the recovery position in which the patient is prone. Turn to left side with right upper and lower limbs flexed. The left upper limb eased out behind the body and the head lifted upwards and backwards to keep the airway clear. Then loosen clothing from around neck, chest and waist. Make surrounding crowd disperse and let the patient get fresh air. Watch pulse rate and respiration. Arrange for medical aid. Do not give anything orally as it may enter the windpipe and choke the patient. Besides the measures described, the patient should be given smelling salt or cut onion to smell. Recovery occurs in 5 to 10 minutes. Tea or coffee should be given once the patient recovers fully. First aid for burns. The first aid measures for burns are as follows. Immerse the burned part in cold water using a bucket, a washing up bowl, the kitchen sink, or hold the affected area under running cold water. Keep the part in cold water for 15 to 20 minutes or until the pain disappears. If that is not possible, soak clean cloth in cold water and put it over the burnt area. It needs to be changed frequently. Application of cold water removes residual heat from tissues and prevents further damage. Arrange for immediate transfer to a hospital. Do not put flour, butter or baking soda on the burn. Do not put lotions, ointments or oil on the burnt area. Do not prick or break any blister that may form. Do not pull away burnt clothing stuck to the body because it is painful. It pulls away skin, creating raw area which can get infected, and anyway it is sterile due to burning. Do not handle or touch the patient more than absolutely necessary.
Let's see how to treat burns. In case your hand gets burned by electrical appliance, what to do? Cool the burn. Hold the burned skin under cool running water or immerse in cool water until the pain subsides. You can use ice cubes if running water isn't available. Protect the burn. If needed, cover the area of the burn using a cool, moist bandage or a clean cloth. Do not apply oil, lotions or creams. Apply a petroleum-based ointment 2 or 3 times per day. Painkillers such as ibuprofen can be taken to get relief from pain. When to see a doctor? If any signs of infection is seen, or if the burn blister is larger than 2 inches or oozes, if the redness and pain lasts for more than a few hours, or if the pain gets worse.
First aid for when a person is choking. When a person is choking, the Heimlich maneuver is performed. Both the hands kept over each other and tight sharp presses to the chest. And eventually the person will spit out what he had choked on.
Dog bites. If first aid measures after a dog bite are: wash the wound with soap in clean running water. Abrade the area and apply pure carbolic acid or a strong solution of potassium permanganate. Dab the area and apply sterile dressing. If the bleeding is severe, control it. Take the patient to the hospital.
First aid for snake bite. Lay the patient down and reassure him, as he is usually very frightened. Though most of the time, his life is not in danger. Wash bitten area with plain water or soap and water. Arrange for immediate transfer to a hospital. With the kill snake if possible. Tie a tourniquet above the bite and keep the bitten area above heart level.
First aid to be done for fractures. Step 1. Make the patient comfortable. Step 2. Give him proper airway breathing. Step 3. See which part is fractured. Step 4. Take 2 or 3 straight stick or wooden pieces. Step 5. Place the stick on both sides of fractured area. Step 6. Tie it with ideally grip bandage. If it's unavailable, take a cotton cloth piece. Tie the fractured area. Make it straight way to immobilize the fracture. Step 6. Call the ambulance and send the patient. Presented by Paushika Rajesh from Grade 10. Thank you.
I am Ashley Danica from Grade 10B. I am going to demonstrate the first aid tips on fracture. Step 1. Step 2. Step 3. This is how we should give first aid for a person who has broken his arm or a leg.
Let's see how to treat cuts and scrapes. Wash your hands before cleaning the wound. This helps to prevent the entry of any infection in the wound. Stop the bleeding. Minor cuts and scrapes usually stop bleeding on their own. If needed, apply gentle pressure with a clean cotton and elevate the wound until bleeding stops. Clean the wound. Rinse the wound with water. Keeping the wound under running tap water will reduce the risk of infection. Wash with soap water. Remove any dirt or debris with tweezers. Apply a thin layer of an antibiotic ointment or petroleum gel to keep the surface moist. Dress the wound if needed. Get a tetanus shot if you haven't had one in the past 5 years and the wound is deep or dirty. Watch for signs of infection. When to meet the doctor. If the wound is by 1 centimeter, you can just put antibiotic ointment over it or cover it up. If it's bigger than that, go meet your doctor and get your wound stitched.
This is Abhinand from Scout and Gates with a few Ayurvedic health tips. Green tea has stress relief properties such as L-theanine that helps us to be calm and reduce anxiety. Tulsi, turmeric, cinnamon and cardamom have antioxidant and inflammatory properties that helps us to prevent from diseases. Consuming lot of leafy greens such as lettuce and spinach helps in glowing skin. Drinking coffee before bedtime can disrupt your sleep and keep you awake during night time. Ayurvedic herbs such as cardamom, ginger and cumin can cure indigestion in the body. Triphala is a botanical formula consisting of 3 Ayurvedic herbs which can cure cancer. Gul is an Ayurvedic herb traditionally used to cut cholesterol and thus prevent cardiovascular diseases. Ashwagandha is a very useful Ayurvedic herb which helps in boosting the immune system, helps in weight loss and improvises the heart health. Thank you.
Hello everyone, this is Godwin. I hope you find this video useful. We present this video because the knowledge of first aid promotes a safer and healthier environment. I'll see you very soon in SHIS campus. Till that, you take care of yourself, your family and your society. Thank you.